Hi everybody, so my name is Taylor Green. I'm 27 years old and I live in Pennsylvania. Reason for my page and my post. On March 26th of 2021, I was diagnosed with thyroid cancer. People can follow my journey, hopefully learn some things that can hopefully help them or somebody that they love. I kind of lose breath quickly now. It hurts me to speak for long periods of time. But just bear with me, and I'm going to take you guys from the beginning of when everything started happening to me. Nobody wants to hear the word cancer. The first thing that popped into my head was my son. My son's 3 years old. I was like, what is going to happen to my son? If something happens to me, I can't leave him yet. He's only 3. I didn't see him grow. Who's going to take care of him? Mind you, I have amazing family support. His father is amazing, but that's much higher. No one can use it's a mother thing. That was the first thing I was worried about. I wasn't even worried about myself. I was worried about my son. I already have really bad anxiety, so that was the last thing I wanted to hear. So you can imagine all the emotions I had inside of me. Had a panic attack once I found out. I just didn't want to hear that. My doctor did reassure me that thyroid cancer is one of the most curable types of cancers because it's very slow growing and they can take it out with surgery. And most of the time, you do not need iodine radiation and it doesn't come back. With some people, it can spread to your lymph nodes. So I'm going to be having an ultrasound done in a few days because, I have been noticing some of my lymph nodes swelling up on the left side of my neck. That's been causing me ear pain. Start by telling you what made me go to the doctor in the first place. So I would say around the middle of December is when I ended up getting really sick. I think I had COVID. I didn't get tested for it. My doctors told me I probably just had the flu really bad. They prescribed me amoxicillin. I was taking that and I was also taking Mucinex, and I started to have problems swallowing. I'm like, I had the flu before. I pretty much get the flu almost every year, and I'm like, this is not right. I would go to urgent care and I'm like, something's stuck in my throat. And they're like, oh, you probably just have strep throat. They did a strep test. Test came out positive for strep throat. I took the antibiotics for that. But I took the antibiotics and didn't work. I was still having trouble swallowing. It then got to the point where it felt like I was swallowing glass and my throat was bleeding. So I would constantly go like to try to get it out. I was sticking my finger down my throat. I was gagging because my finger was going too low because I was thinking there's something in there. I then started to notice that I was getting thrush. Thrush is when your tongue starts to turn white. So the very back of my throat was starting to turn white in my tongue. And it was starting to spread and get closer. So now I was freaking out. I went to urgent care. And that's when they told me, oh, you look like you have thrush. But usually people who have thrush are people who have cancer or infants because they're putting like dirty things in their mouth. At the time, I'm like, well, I don't have cancer. They told me to go to my primary care doctor. I did go to him, but in the meantime, they did prescribe me medicine that dissolves on your tongue to get rid of thrush. When I went to the doctor, he asked me actually if I had dental issues, and I did tell him that I noticed my wisdom teeth has been bothering me, like the excruciating pain to the point I was crying. I was taking Tylenol PM just so I can fall asleep. But due to COVID, I had to wait 3 months before I could even see the dentist. So in the meantime, he prescribed me antibiotics just in case I did have an infection because he told me usually infections in your mouth can spread to your throat. So he also wanted to swab me for a strep test. I did the strep test. It did come back positive that I had strep throat. So I was thinking like, oh, okay, maybe this is why I'm having issues. I have strep throat. Started taking the antibiotics for strep throat. I started to feel a little bit better. Then I noticed I started getting rashes on my throat. The rashes would start from like up here and come all the way down to my chest. And the rashes were red, very, very itchy. I started to break out in hives. I ended up going back to urgent care, and they told me that it looked like I just caught allergic to reaction to something that I ate. I didn't eat anything out of the normal, so I was telling them, like, this can't be right. I don't think I have an allergic reaction, but they told me just take Benadryl. I went home, I took Benadryl, and it did stop the itching, but I still had the rash. I started thinking that, okay, maybe I'm allergic to braiding hair, which was weird to me because I wear braids all the time. But I was just trying to think of different things like, okay, maybe my skin's changing. Maybe I'm allergic to the braiding hair that I was using. The type of braiding hair I ordered off of Amazon was causing me an allergic reaction. I took out my braids, still having the issue. Okay, maybe it's my chain. I don't think it is, but maybe it's my chain. I've been wearing this chain all this time, but maybe my skin's different now. Took the chain off, still having the issues. Maybe it's my perfume. I even stopped wearing perfume. I stopped using scented lotions, and I still had this rash. But now this rash was starting to go down to the side of my breast. Now I'm freaking out because I'm having trouble breathing with it. So it felt like I was being strangled. When I felt like I was being strangled, the rash will get brighter. I ended up going to St. Luke's Hospital, and they diagnosed me with shingles. They gave me antibiotics. I went home, I took the antibiotics, my rash started to go away. So I thought, okay, maybe I had shingles. A few weeks go by and I'm having trouble swallowing. My voice is getting hoarse and I'm tired. I'm so tired. And I'm thinking my son was wearing me out or I was bored because of COVID. I'm thinking, okay, maybe I'm just bored. This is why I'm so tired all the time. I said, let me start doing exercising and eating healthy. I tried eating healthy, nothing changed. I tried exercising and I couldn't. Within 5 minutes of my exercising, I was losing breath to the point I couldn't breathe. I had to sit down. I was chugging water, like 5 water bottles at a time, no exaggeration. And my throat was so dry. I was kind of gasping for air. This is not normal, but maybe my strep throat came back again. I went back to my doctor, explained everything that was happening, and he's like, maybe your strep came back again. I'll prescribe you some more antibiotics. At this time, I was on Google, and I'm like, stay off of Google because, the first thing Google always says is cancer. So I'm like, it's cancer, it's spreading, it's going to my brain. Oh my God, I'm freaking out. I'm calling my mom. My mom's like, there's nothing wrong with you. If you had cancers, the doctors would have told you, they would have been detected it. There's nothing wrong with you. You're a hypochondriac. You're driving yourself insane. And I was literally driving myself insane. Like, nobody understand. My anxiety was to the roof, and no one understood that, like, I've always had problems with anxiety, but it was to the point where it was unbearable. To the point I couldn't control my emotions. So I was starting to freak out because I didn't know what was going on. I was like, am I pregnant? Because why are my emotions, my hormones, everything's just out of whack. I went back to the doctor after the antibiotics. The antibiotics didn't work. And he's like, we can do blood tests for you. He did my blood test. Everything came back good. He's like, there's nothing wrong with you, sweetheart. You're fine. You're driving yourself crazy. So I thought that, okay, you know what? Maybe it's me. I'm driving myself crazy. So the symptoms that I was having, I was kind of ignoring them because I was like, I started to think I was telling myself that there was something wrong with me and there isn't anything wrong with me. So I was kind of just brushing it to the side. But slowly, I'm like, no, this ain't right. There's something wrong with me. My thrush is coming back. I'm starting to see spots. I couldn't go a day without wearing my glasses. If I didn't wear my glasses, I would get nauseous. My headaches were like pounding headaches. I couldn't close, even if I would close my eyes, it was horrible. I'm starting to get the rashes again. My ears were bothering me. It felt like there was something in my ears. And once again, I felt like I was swallowing glass. So I went back to urgent care. When I went to urgent care, she's like, sweetheart, you're young. You just did blood work. You've been taking antibiotics for almost 6 weeks now. There's nothing wrong with you. Okay, so I'm like, you know what? Maybe there is nothing wrong with me. But then I start freaking out like, you know what? I don't really like these doctors out here. So I was thinking like, they're just giving me any doctors. I'm on state insurance. They don't care about me. I need to get United Healthcare because when I did have United Healthcare, I went to Jersey from when I was experiencing issues. I would call my mom every day, call my sisters, and they like make jokes like, there's nothing wrong with you, you're crazy, you're driving yourself crazy, you can't do that, like you need to stop. And I noticed that like my appetite changed. So I was eating more, but I was losing weight. And I've always been skinny, and my family does have a history of thyroid issues. So as I was doing research, I was thinking that maybe I just have hypertension thyroid because all the symptoms, very skinny, hard to gain weight, increase of appetite. So I went to my doctor. I explained everything to him. And I told him that I noticed I have a lump in my throat. He felt my lump and he said, okay, I'm going to write you a script to go get an ultrasound. I got my ultrasound done and they noticed that I had a small nodule, really tiny. It was probably like 1.6 centimeters on my right thyroid. I went to go see a endocrinologist. In the meantime, she said that she recommends a thyroid biopsy. I ended up doing my thyroid biopsy and what that is, I'm sorry, is a fine, very fine needle. They stick it into your thyroid, they numb you, and then they took 5 other skinny needles, stuck it in my thyroid, and went up and down a few times. They did that 5 times, and then they drank fluid out of it and sent it over to a lab. This is, I actually still have the scar from my biopsy. I kind of bruised from it. And you can see I kind of also have like rashes still that come here and there. Like here's some scars from it, I guess from like scratching so much. And you can also kind of see over here where it's swollen. I started experiencing lately pain over here as well, but my fingers crossed that it didn't spread anywhere. So let me get back to my story. I did my biopsy and my results came back atypical, which means there are abnormal cells in my thyroid, but it wasn't enough to rule out cancer. I'm freaking out because I'm like, abnormal cells? No, there's not supposed to be anything abnormal in my body. Oh my God, I have cancer, I have cancer. I'm calling my mom. My mom's like, there's nothing wrong with you. If you had cancer, your biopsy would have came back cancer. Contacted my endocrinologist and I told her like, listen, all my symptoms are coming back and they're worse this time. So I'm thinking like, did you guys puncture something when I did my biopsy, because I'm not understanding why after the biopsy now I'm having more issues. So she said, okay, what I'm going to do for you is you're going to wait 2 to 3 months and I want you to schedule another biopsy. Because if it is cancer cells, which is very rare, you're young, you're healthy, I don't think it's cancer, but to give you a peace of mind, we're going to rule this out for you. Do another biopsy. So I scheduled my biopsy for March 24th, and that was my second biopsy. And when they're doing my ultrasound, they said, oh, okay, so, you know, they called it he grew a little bit more. I was at, if I'm not mistaken, like 1.6 centimeters. Now my nodule was 2.9 centimeters. They said, you know, it did grow, but in some cases, you know, they're benign. The percentage of it being cancer, especially at your age, is a 10% chance. So, you know, it kind of was making me feel better. But a part of me was like, I don't think so. Because, call me crazy, but I was driving one time and I seen cancer survivor, breast cancer sticker 3 times in a row. And I'm like, call my mom, like crying, like, Mommy, I think this is a sign. I think they're going to tell me I have cancer. Stop it, Taylor, stop it. Like, this is not healthy. You need to stop it. I went to Walmart the day after my biopsy, and some guy comes up to me and he's like, excuse me, miss. God wanted me to tell you that he loves you and that he's with you. And I'm looking at him and I'm like, what? He's like, he wanted me to tell you that he's coming for you. He loves you. He's here with you. And then he goes to my son. He's like, you know Jesus was black? Black Messiah. My son's like, the Black Messiah? He's like, yeah, the Black Messiah. You know your mommy loves you, right? Then he walks away. I get in my car and I break down hysterically crying. Mommy, is this a sign? I call her like, am I about to die? Am I about to hear that I have cancer? Why would he come up to me? My mom's like, you know everybody that hang out at Walmart? Maybe he was a drug addict. Like, Taylor, everybody who be in Walmart is crazy. Why you listening to him? She starts laughing. I'm like, no, Mommy. Like, what's the coincidence that 2 days in a row now I'm seeing cancer this, cancer that. Somebody's telling me God's coming for me. What does that mean he's coming for me? Does that mean he's about to take me? Now I'm full-blown panic attack. I couldn't even drive. Had to get myself together because my son started to cry in the back seat. And I'm like, okay, let me get myself together. And I already had an appointment set up with a surgeon because I was having a nodule growing. I was only supposed to get the right side of my thyroid removed and not my left side. So I went to my appointment on the 26th. And when I go there, he's talking to me. He's like, okay, so April 15th, we're going to remove your thyroid totally, and we're going to start you on hormone pills. And I'm like, no, you have to wait till my results for my biopsy come back. I was told from my endocrinologist, you only remove your thyroid if you have thyroid cancer. And I don't have thyroid cancer. My biopsy didn't come back yet. And he's looking at me. He's like, no, you have cancer. And I'm like, what are you talking about? I just did my biopsy 2 days ago. They told me it takes about a week for my results to come back. I don't have cancer. He's like, your doctor didn't call you yet? And I'm like, no, she didn't call me. He was like, oh, I'm so sorry. He said, I thought you knew that's why you was here. He was like, you have thyroid cancer, papillary thyroid cancer. And he told me that it is the most curable type of cancer that somebody can have. He said if everyone was to choose what type of cancer they wanted, thyroid cancer. It's a cancer you will want, because it's very curable with surgery. You don't really need chemotherapy. You don't need radiation unless it spreads to other parts of your body, like your lymph nodes. So he sent me to the lab to do lab work and to do a EKG because I've been experiencing very bad heart palpitations, like horrible, to the point I've been to the hospital 2 times for my heart, and they were telling me that I was having anxiety attacks, and I was telling them I cannot be having an anxiety attack if there's nothing to have anxiety over. They swore I was having an anxiety attack and I just needed to calm down. I'm guessing this is why, I don't know, maybe it's the cancer, but why has my heart been bothering me really bad, to the point where I cry because that's how bad the pain is. My left arm also starts to go numb sometimes, or I start to shake. It doesn't last too long. It just lasts for however long my heart's bothering me. So he did a EKG. They seen that I have some abnormalities going on with my heart, but you know, I do have heart conditions that run in the family. My dad has heart problems. My little brother has a heart murmur. So I was like, you know, maybe that's why. And then he said he felt that I had swollen lymph nodes, and since I've been complaining about my ears and my teeth and my chest, he scheduled a ultrasound to check my lymph nodes just to make sure the cancer didn't spread. If the cancer did spread, then he would have to remove those lymph nodes when he removes my thyroid, and then I would have to go on iodine radiation. That's what I'm praying that I don't need to do. Hopefully it's just a surgery and I don't need to do anything else, but we'll see. You know, he told me the risk of the surgery: permanent damage to your vocal cord. So that would cause like hoarseness to your voice changes. My voice already started to change, and I mean, it's been like this for a few months now, so it's like, whatever. So bleeding, which he said is very rare, and he said the most difficult part is my hormones. So they're gonna put me on a hormone supplement that I need to take every single day for the rest of my life. Told me to try to not miss more than 1 dosage, because then I can end up in the hospital, because they're going to remove my thyroid completely. My body won't be able to produce hormones, and you need hormones to survive. So they're going to give me that supplement, and he told me that's going to be the hardest part, is adjusting to my body, because they have to get the right dosage, right? So pretty much what they're doing is they're guessing how much to give me, and from there they're going to see if they need to increase it or decrease how much hormones that they're giving me. You know, so moodiness, tiredness, muscle weakness, all that good stuff. They're going to make an incision right here at the bottom of my throat, remove my thyroid. He said I'm going to have a scar, but he did say that because I'm young and I don't have any other health conditions, that a lot of people's scars heal up very nicely, and sometimes you won't even know that they had surgery there. So I'm praying that goes forward with me. So I'm going to end my video right here, and I'll come back in a few days to let you know how my test went. You know, what are my next steps going forward, how I'm dealing with my anxiety for surgery, because I'm petrified. I don't want to get surgery, especially because it's right here. It's on your neck. I have a lot of nerves there, so they can get punctured. This is a lot that can happen. So, you know, finding the right surgeon is the most important part. So, you know, I did find a surgeon who can do my surgery for me on April 15th. I am still kind of searching around, and hopefully I can find a surgeon in Allentown, because I don't really feel too comfortable with the Pocono Medical Center. So I'm still going to do my research, you know. I pray every day, trying to find my faith back. A part of me is like, why me? I was just healthy not too long ago. Why me? Why now when I have a son? Why now when I have somebody that depends on me? You know, everything happens for a reason. I don't know what the reason is, but some of the things you can't control. Maybe this was to help me find my faith again, because I would say I started to lose faith slowly. I didn't stop believing in God, but I did stop losing my faith, because I was like, why are bad things happening to me, like health-wise? Because nobody understands the things that I was experiencing. I thought I was going blind. I thought I was going deaf. Multiple times I've been to the hospital because I thought I was having a stroke or a heart attack. And I just got so sick and tired of hearing people say, there's nothing wrong with you. There's nothing wrong with you. You're healthy. You're healthy. You're making yourself sick. And I'm like, no, there's something wrong with me. So I'm very adamant, and I'm very big on, you know your body. So if something doesn't feel right with you, do not let anybody tell you you're fine. Because if I did, I would still be going around thinking like, okay, I just got strep throat. My body's having issues. All the doctors I've been to told me there's nothing wrong with me. So there's nothing wrong with me. And for, my cancer could have got worse. I could have caught it on later on in life when it spread to different parts of my body. So I'll get back to you guys soon. Thank you for taking the time out to listen. And thank you for whoever comes along this journey with me. A few more days for my surgery, so I don't have to walk around with knowing I have cancer in my body. So, thank you.